Hi everyone, welcome to the Lakeview video podcast series. I'm pleased today to be joined with Monique Rodriguez with Austin Embodied Therapy. It's good to have you here.
Thank you.
We're interested in learning more about your background and how you got into the field. I know that you spend a lot of time in working with adult children with child abuse issues.
Correct.
You do a lot of addiction work. How did you get in the field of addiction treatment?
I really was called to this work from my own experience. I started out by working with adult children of alcoholic, ACOAs, from my experience of being an ACOA. And then I was just called to the work to start working with addiction. It kind of just found me. It started showing up at my door, and honestly, I was resistant to it. I knew that that's not what I wanted to do. Being an ACOA, it felt a little too close to home. And then it just, the clients kept coming. And something that my supervisor always told me when I was an intern, like learning this work, was that they're coming to you for a reason, and this is important work, and you're doing an amazing job. And so one of the things that I always remember, even till this day, is that like if my work is working and I'm changing people's lives and I'm making these connections, my resistance is just part of my own journey and my work to continue doing, but this is the work that I should be doing.
Isn't that interesting? We had a conversation yesterday with someone who said the same thing, where she said, I had no desire to go into addiction treatment, and it's usually the ones that are the most profoundly impactful in the industry that were usually the most resistant at first.
Yes,
so
I agree.
I think there's something to that. So, well, we're glad that you're in the field. You also do a lot of work with Gestalt therapy. Can you talk to us a little bit about what that means?
Yes, Gestalt is a very experiential, relational, phenomenological approach. And what that means is I work a lot with the here and now, with the client's experience, specifically their subjective experience. In Gestalt therapy, the client is the expert of their experience. And my work, I do not work on putting my own beliefs or my own specific treatment or goals on them. It's really about where they are today and how to integrate their current state, their current body, their current awareness into the world, rather than focusing so much on the past. It's all the same to me. Rather than sitting here and getting a client to go into their past history, their addiction, how this came about. It's all very important, but what's really important to me is the data that I'm finding right now with you, because it's all going to be connected. And if I can focus on that and help the client be more aware, raise awareness, raise body sensation, and focus on their experience, they're better able to integrate that when they leave.
And isn't it true that if you spend too much time in the past, it can be re-traumatizing sometimes?
Correct.
So it
and
sounds
also
like it's a great
knowing
service.
like when to go there and when not is very important. And sometimes it's better to just stay here today than to be going.
What would be an example of a type of experiential therapy that you would do with them in applying the Gestalt theory?
Well, for one, for me, Gestalt therapy is all experiential.
Okay.
So when a client comes in and is feeling like they don't want to be here, I find this happens quite often. I challenge clients to be able to not be here. If they're ready to leave, I give them permission to go.
I know, that's different.
Yeah. And a lot of times they're really taken back by this idea of, my therapist just told me I could walk out the door. I've had someone do it, and I've had somebody cry and look at me and say, no one's ever given me the option to go.
So empowering them to feel like they have choice.
Correct.
That's really important. Very important in early recovery as well, so
Yes.
that's great. Well, it sounds like you've got a really unique service, and I'm sure people who are watching today would love to learn more about and maybe even ask for help through your services. If someone wanted to reach out to you, how could they do that?
I can be reached at austinembodiedtherapy.com, and a good phone number for me would be 512-902-4357.
Thanks, Monique. It's really good to have you in Jacksonville, and
Thank you.
good luck with your practice and all that you
Thank you
do.
very much.
For those of you that are interested in learning more about Lakeview Health, we invite you to visit us at lakeviewhealth.com. Or if you know someone who needs treatment right away, we invite you to visit us. Call us, please, at 866-887-0142.